Once upon a time, a team of 5 superheroes went abroad to deliver medical services to the suffering citizens of Global Town. The superheroes were so proud of themselves for bringing supplies to the people of Global Town. However, the people were disappointed. This was not what they wanted. They thought to themselves, "You're not listening to us." The superheroes were disappointed in themselves. They thought they were being helpful, but with all of their efforts, they had not truly contributed anything. They decided to regroup and try again.
Before we go back to Global Town, how could we avoid repeating the mistakes of the past?
Well, I think that we approach this community like we had all the answers. Maybe we should learn from our time there, like the famous quotation, "Knowledge speaks, but wisdom listens."
What does that mean?
I think I know. When I was on my psych rotation, we were consulted for a patient who was aggravated and refusing care. She was labeled a tough patient. We were tasked with figuring out why this was the case and whether she had the ability to refuse care. She had recently lost her vision due to complications from diabetes. People would come in to discuss the plan with her, tell her what was going on, and then without announcing it, leave. Thinking they were still in the room, she would try to discuss her goals of care and what she would like, but would be talking to an empty room. When I went in and talked to her, she immediately burst into tears. Her refusal of care was her way of communicating that she was upset and overwhelmed that no one was listening to her. She felt as if the team would not create a plan that adequately addressed her goals of care, so why would she listen to them?
That's a really good example. That reminds me of an experience I had that embodied that quotation.
Tell us about it.
Well, I struggled to use motivational interviewing as a tool with patients who suffered from substance abuse. It took me a while to understand that the source of my struggles was the spirit of motivational interviewing, listening, and collaboration. I had unknowingly slipped back into the habit of providing information over trying to understand the patient and reflecting that in conversation. I realized that I did so out of fear of needing to have all of the answers. Once I embraced listening and the spirit of collaboration, I was able to give my patients the space to explore the emotional and life stressors that contributed to their conditions. It was the wisdom to step back and listen that gave them the space to heal and have almost miraculous transformations, sometimes in the space of a few days.
Oh, I get it now. I really think that reflecting on these experiences will help us be more effective when we return to Global Town.
Whether Staples of Health is fortunate enough to aid in Ecuador, Guatemala, or Dominican Republic, we will be 5 people with diverse backgrounds entering a community that we are not a part of.
We all have a robust knowledge of physiology, pathology, and healthcare systems.
Although we aim to provide groundbreaking care using that knowledge, challenging ourselves to listen first and speak second will allow us to build a strong foundation to actively support the current efforts of local agencies.
Indeed, we can never have more knowledge about how to help the community than the citizens of these countries. Our job as providers is to advocate and empower those for whom we work. We hope that this experience will allow us to grow as future providers, caretakers, and people. In that way, we can never have more knowledge about how to help our community than the citizens of these countries. Our job as providers is to advocate and empower those for whom we work. We hope that this experience will allow us to grow as future providers, caretakers, and people.